So without more ado, can I introduce you to Kathy and Kenny from Resources for Autism, and Kathy perhaps more so as her role as a parent. So over to you.
Good morning, everyone. Yes, so we're going to, thank you for coming. It's really good to see the interest. We're going to run through some slides. Part of this presentation is, generalize the cost of having a disabled child and how difficult it is to, survive in that situation financially. And the other part will be partly me sharing my story, and Kenny some of the stories that he's heard from our service user cohort. As Liza said, this isn't just about me. If you have stories, if you're as a parent, if you know things, it would be really good to engage and chat so that we can see where we go with this in the future. So could we start with slide 1, Keir, please?
Yep, 2 seconds.
So this is what we're talking about the costs of raising a disabled child and the things that are hidden underneath that you don't see, to the eye at first. Could we go on to the next slide? So when I was planning this, I started looking into how much does it cost to raise a child anyway. We know that's an expensive business, anybody who has a child. And the crux of today is looking at these statistics at how much more expensive it is for a family to raise a child with a disability. So you can see from the figures here, there's a big, from this research from Scope, mainstream child 71,000, disabled child 287,000. That's a big figure. Also, we're looking at parents who are in a position that they've got these much higher outgoings, where there will be many more barriers to what they can bring in to their income, to how much they can work, how much they can train, how much of a difference they can make to contributing to family life, which will affect, their stability, their savings. So we've got this double impact of not only are your outgoings higher, there's many more barriers to your income. So I wanted to, that's the starting position, and I thought I'd like to dig more into that and see how that looks. So if we look at the next slide, I've made some really simple examples from my experience. So if a t-shirt costs £10, it's winter, you've got a stable wardrobe, you want to buy your children some for winter season. 5 t-shirts, £50 for 6 months. A lot of the young people that we work with, every session that they come in, every time we see them, will become distressed, and when they become distressed, they will rip their t-shirt off. They'll rip it in half. Other children with sensory issues will chew at and bite and pull the threads out of their t-shirts. We've also worked with families at home where when the child is upset, they go into their wardrobe and destroy all their clothes, because it's that ripping feeling, that sensory feedback can be really satisfying. But if you have to replace your child's t-shirt every 2 days for 6 months because they can't walk around in a ripped up rag, that's £900 over 6 months compared to £50. My daughter came home. She had a bed with a mattress, but now she needed a specialist air mattress to prevent pressure sores, to make sure that she didn't have further injury in her sleep. If I go on Google, I can get an average single bed mattress for £160. If I want a specialist air mattress, it's £800. So just by looking at these 2 things, which children need, they need clothes and they need somewhere to sleep. We're not talking about luxuries. We've already got this disparity of spend on what a mainstream parent would be spending and what the parent of a disabled child has to find from somewhere. Okay, so the next slide. So this is where I tell you a bit about my story. My child wasn't disabled from birth. We were working, she was at school, she was at primary school, she was on the gifted and talented register, she seemed to be really thriving. I was working, and what I'd done, I'd increased my hours as she grew. So as she went through school, I did some more hours. I was able to reduce the tax credits. I was able to pick up more work, take on more of a role. I was able to move to a better property. We were in a very small property together, so I managed to get somewhere where we had our own bedrooms, buying uniform for school, thinking, you know, this is okay, we're getting by. I am probably worth mentioning that I'm a single parent doing this as well. She went to secondary, and all of a sudden she got sick. She was anorexic. She had mental health issues, and everything just stopped. I took her in for an appointment. We knew something was wrong. You know when something's not right with your child. So we went to CAMHS at the Royal Free for an initial assessment. The consultant assessed her, put her on the ward, and she didn't come home for another 2 years. So she's now living in hospital. They said if she hadn't have gone in at that point, she would have died in the next 48 hours. So now I'm feeling a bit stuck. You know, I'm meant to be at work. It's pre-summer. We've got a summer scheme coming up. I can't, this is my child. My child is more important. I have to ask for a big chunk of time off work. You know, I had to say, I'm not coming. I was lucky that I managed to negotiate that. I had a very understanding manager. Other people aren't in that position. It could have been very well that life just stopped at that point, that I lost my job or I was put onto unpaid leave. So I'm here, I'm at the unit. Then the demands for the extra money start coming in. We don't provide bedding on this ward. You'll need to buy clean duvets, pillows, covers to bring in. Your child's the only patient on this ward, so you need to bring things in to entertain her. If you want a TV for her to watch, that's more money. If she wants a puzzle, a magazine, something to do, it's all extra spend. By the way, you have to come and visit every evening, every weekend, and during the summer holidays, because she's the only person here, we'd like you to be here most of the day. This is a eating disorder ward that she's on at this moment, but my child also has SED, which is selective eating disorder. So they're trying to refeed her from the hospital trolley, which she can't eat. She can't deal with the textures of those foods. So I'm now doing 2 food shops, one for at home and one to take into the ward so that she can make her own food there. The costs are going up and up. I don't live in hospital. I have to travel in every day and travel home again. It starts to calm down around September, October, and then the meetings really kick in. She needs physical examinations. You've got to have time off work to take her for this x-ray, to have tubes put into her to see if there is something physical going on. As part of the admission, you have to have family therapy every week and you have to attend a parent training course. So that's another hour a week and morning a week. You can't go to work. We need reviews. We need the key worker to hand over to you. She's going to go to hospital school. You need to talk to the school. You need to provide records. All of these things, I'm thinking, how am I ever going to get back to work while I'm traveling backwards and forwards on the tube and attending all these meetings? I did. I went in, and this is in a time before we were all used to working remotely, before COVID, before Zoom. So really, we're talking about being physically present. I went into work one day. I got there. I was like, wow, I can do the whole day. I got a call saying she's broken her hairbrush. Could you go and buy one and bring it in? And you need it now because she's really upset. Again, I had to leave work. After a year, we got a transfer. We moved to Great Ormond Street. So she was now going to stay at Great Ormond Street. This meant it's further away. It's more travel. I'm having to go right into Central. There's even more meetings, more family therapy, more training. I'm getting the tube every day. One day I decide to go, I'm going to drive. It's Sunday, I've had enough. I go to use my car. The car's seized up because I haven't been using it. I now need to pay to get that transfer, taken away, and I now don't have a car. One of the effects on the whole family, which we'll talk about later, is the stress on the entire family. I'm a single parent, but Steph does have a dad. I thought, I'm really getting into financial trouble here. Maybe I need to go and see him. in the stress of it all, he's had a stroke. He's now had a stroke and he's in hospital too. That's another avenue closed and another person to worry about. You still have to go in the evenings and the weekends. I'm now in Russell Square. They're saying, you know, take your child out, give them something to eat, entertain them at central London costs every night of the week. She begins after a while to come home for home visits on the weekend. More travel, more costs. One evening, you know, she had an incident at home and we had to go to A&E. We're in A&E, it's now about 1 o'clock in the morning. We've kind of sorted it out, but they said we have to discharge her back to Great Ormond Street. We can't take you. I phoned Great Ormond Street. They say, no, we can't come out of the hospital and collect you. I have no car. It's 1 o'clock in the morning. I've got a 10-mile journey to take with someone who's just been discharged from A&E. There's another financial cost. How do I get her back? After a year, she had an unplanned discharge. Things weren't working out. It wasn't doing what it was meant to be doing. And suddenly we had this unplanned discharge. So now I've finally found this balance so I can do a bit of work. I can visit her. Now she's at home 24/7. She's not going to school. There's no services in place. Again, I'm phoning my boss saying, I'm really sorry, but I can't come in. I've got to be at home. We begin to contact people. And this is where another cost comes in for, you know, families with children with disabilities. You need a phone, you need a laptop, you need a degree in navigating, filling forms in to get anything. You have to dedicate time and money you haven't got to technology and calls. After a long battle with lots of advocates, mental health, social workers, everybody getting involved, we managed to get to the tripartite panel and we managed to get the CCG involved. We have this big cumulative meeting and I think, you know, thank goodness we're getting there. You know, finally everybody is listening. And get into the meeting, that's not happening. Everyone's got their own agenda, there's no money, there's nothing forthcoming. My child by this point is banging her head off the table in the meeting with stress. I'm saying to them, I can't do this anymore, I'm done, I'll have to leave my job. If I leave my job, I will lose my home. We are going to be completely sunk in poverty and it's going to have a big impact on her mental health. The answer from the professionals was, okay then. If that's what has to happen, that's what will happen. I carried on fighting, still fighting for carers, still traveling to Hampstead for CAMS appointments, you know, doing a meal plan from home, which means I have to stop working every couple of hours to do a supported meal feeding time. Somewhere in all of this, as a parent, you begin to lose yourself. There's nothing left for you. All that's left is trying to navigate this system, and any money you have is going into keeping a roof over your head and providing what's needed for your child. We got carers. Finally, they said we're going to pay, the CCG and tripartite will pay for home carers so that you can continue working. I work 37 hours a week, plus a bit of travel there and back, plus tax and national insurance. I need to pay the carers about £3,700 a month for the rate they're charging, which is much higher than childcare for specialist home care. I get 1,500 from the CCG, which sounds like a lot of money, but you add that to the 2,000 I take home, just paying for care, I'm now on minus 200 a month before I've paid for anything else. I can't have this care. I can only have a couple of days a week and use the rest to keep a roof over my head. These are just some of the highlights. I don't want to talk forever. We did eventually, she got readmitted. She went through services at the Maudsley, which was fun. So it's like, now let's try and travel to Denmark Hill. I don't even know where it is. It's miles away. Let's do parent training there, reviews, and try and navigate living in North London, working in Northwest London, and having a service in South London. That's not easy, and that's expensive. She went to Simmons House. She had time there. She's now 18 and she's been discharged. At 18, we started again. She's too old for the carers now. It's a whole different team of social workers, care coordinators, everything else. We're trying to navigate the universal credit system. That's not happening. We've been trying to do that for about 6 months. I'm yet to get there. And odd things, all these little costs, which is what I was talking at the beginning, all these cumulative financial costs. My daughter needs at least 6 prescriptions a month. That's £10 a sheet because she's now over 18. She's not in school, they're not free. We can't claim that we're getting universal credit because we haven't managed to navigate them. The doctor decides to send them 1 prescription at a time. So instead of paying £10 for the prescription, I'm paying £60 for them because I'm getting 6 different prescriptions. I asked the doctor to stop this. They say that's not possible. All these costs just keep adding up, and this is what pushes people into poverty. All right, I'll stop now.
Thank you, Kathy. That's really brave of you to share that story. My name's Kenny. It's an honor to be talking to everybody. I've been working with people with disabilities for the past 10 years. And some of the things I've seen in this time, I've seen a lot of parents, as a result of poverty, as a result of being pushed below the poverty line, not accessing some of the services that we have. So we've got one particular person in their 50s, a gentleman who has been coming to RFA for years. And you can see over the time, since his mother's gone into a care home and he's living on his own, you can see how his standard of living has dropped. This is due to his financial instability, because, like I said, people have got grants and they've got certain help, but we always assume that it's enough, and it's most of the time it's not enough because the cost of living is expensive for traveling. A lot of these people have to get taxis as opposed to public transport because of maybe sensory conditions. They can't be around too much people or different things. So it's much easier to be in a taxi, but taxis cost more money. There's things that, even like personal things at home, like getting the cleaners. I've got some people who that cannot access a cleaner because it's either that or the price of food. You have to choose between food or a cleaner, or between food and personal health, basically. So some of the young people come in. We've got parents who they've been attending for years, bringing their children, but they drive now. Petrol money. They've got alternative therapies that cost, because some of these things are not on the NHS. So it's constant costs. But the thing is, when we go to the house, we might look and say, oh, they've got a nice TV. Oh, they're doing okay, but they've got nice clothes, but they haven't eaten for the whole day. And that's the things we say, the hidden, not the hidden disability, but the hidden poverty. Because it's really brave that Kathy can tell you about her story, but not a lot of people can tell you their story, so we don't see what they're going through. And this is happening on a daily basis with a lot of service users and families that we support. Because
Kathy and Kenny, we have another parent on who would like to share some of her story.
oh,
Are you
brilliant!
okay
Yes,
for her to
please.
do that now?
Yes, please. Yes, please.
Sue, are you happy to share your story now?
Yeah, sorry, I just need to get my camera on.
That's okay.
Oh,
Hi, Sarah.
Hi.
oh, sorry. It's I really admire Catherine. It's just unbelievable what you've had to go through. I just, it sort of wrenches your heart to think that you've gone through all of this. And my little story is nothing like that. It's just a different perspective, really. My son is autistic and 18 now. He's still in education. He's been in the same school since he was 5, so we've been really lucky. But it was just thinking about the costs and extra costs, which is different from your completely different from yours. It's things like he cuts his clothes up. You buy him uniform for school, and the tracksuit and all this type of thing. And then he cuts it in half, like to make the thing smaller. So he's got all these shredded clothes in his room. So then you have to sort of replace everything. And there were certain things like, he gouges out, he gets a knife or some scissors or something and gouges out the furniture. So if you've got a nice, your dining room table or sideboard or something, there's just all this scratching and marking, and so he's ruined everything, you know, and broken the leg off one of the tables. I don't really know how it's still standing up. And then when he used to have his meltdowns, get really angry, he'd bite. How he's got any teeth left, I don't know, but he would bite the door frames, you know, so there's all the teeth marks in them, and he'd really grab hold of the doors and swing on them and smash them and everything. So, excuse me, I just mentioned that his door is now off its hinges because of all the use. So we have to pay for someone, because now it's been, my husband's repaired it many times, but now all the framework has gone, so the whole thing needs to be replaced with a new frame and all the, probably the door as well. And then he started to get all the food out of the fridge, like eggs and things like that, and go down the side of the house and start smashing them up against the windows and the walls. And you know, I couldn't work out where the food was going. It was obviously going in the garden. And what else did he do? He pee out of the windows. That was that it comes at a cost, because you know that I have to clean, you know, all the cleaning stuff that I had to buy extra and go up there with bleach and flash and clean everything. Once I was standing outside my front door and talking to my friend as she was just leaving, and I thought it was raining and he was actually peeing on my head.
Oh no.
And it wasn't that long ago, it was only about 15, so about 3 years ago. So there's things like that. He now doesn't pee out of the windows, but he now pees in bottles. So they're around the house, and not that that is a cost implication, but you know, if anything gets knocked over, you know, there's a lot of cleaning and all that sort of stuff, and that's it really. It's mostly sort of damage to household things. I mean, sometimes he'll throw something out of the bathroom. He dropped a tray, a soap dish on the floor and smashed all the tiles, so then he threw that out of the window. So he just throws things and gets really angry. So it's just really that sort of cost. I can't really say there's much of cost in really anything else for him, because
But all that
you know,
adds up.
Yeah, that
Yes,
means
it
broken
does.
doors. That definitely adds up.
We have a parent who would also like to share now, if that's okay with you, and that's Esther. Esther, would you like to come in now?
Hi, so I've got a 6-year-old boy, and he has autism, ADHD, sensory processing disorder, and dyspraxia, and he was floundering at in mainstream school, and he was out the classroom. We worked out for 3 days a week for OT and SLT. We had to pay extra for some therapy. He was also having play therapy, and then it got to the point that he couldn't cope in mainstream, and they couldn't really cope with him. So we looked at a special school, and we found the special school that we wanted, but we had to fight borough to get it. So we actually had to get a lawyer, and then for that we needed an extra OT assessment, SLT assessment, and other assessment. And altogether with the lawyer, I mean, he's now in the special school. It cost us 21 grand.
God.
Yeah, 21,000 pounds to get him into a special school. And then when we got there, the borough said that he can go in a taxi by himself. And I'm like, he's 6 and he's got special needs. He's not going by himself. And so I had to phone social services. I had to go. So at first I was going in, so I had to pay to get to school, £30 a day in taxis until transport agreed. We had to pay to go to tribunal, which cost an extra 6,000, and then to take him to and from taxis every day, because I'm not sending a 6-year-old runner by himself in a taxi, which the borough didn't understand. Then we had to fight for an escort, which we've now got. So he now gets full funding for the school, and he gets the escort and everything. So now it's working out well, but it did cost us 21,000. Also, he can't do normal football or anything because he can't cope in a group. So we've had to pay extra for 1-to-1. We've had to pay extra for 1-to-1 swimming because he was disturbing the group so much. We've had to pay extra for music therapy because his school doesn't do that. And even though we're doing music therapy actually through Resources for Autism, so it's much cheaper, but it still costs a lot. And on top of this, I'm disabled myself. So yeah, that's just a bit of mine. So it cost me 21 grand to get my son into special school, and now he's actually flourishing now that he started there. But it's been really, really hard. And
Yeah.
as I'm disabled and can't work, it's been a nightmare.
Yeah, thank
Yeah,
you for sharing.
and
We've
we-
got some other parents, but what I'm going to suggest is that we go back to Kathy and Kenny and then perhaps bring other people in towards the end.
Yeah, that would be great. I mean, I think listening to you, you know, something we certainly talk about tribunals in a later slide. And, you know, it's these things, it's things that I forget until people are telling me. When my daughter came home, we had to suicide proof the house. I had to throw a lot of possessions away because they were dangerous, they were glass, they were knives, but we also had to put a lot of locks onto some places, buy a medication safe, and other places like the bathroom get the locks removed. And I really felt what Stu was saying about, you know, this is your home and you're having to modify it, change it, have it broken, replace it because you want a decent standard of living for your mental health. We had, because anorexia is disgusting, my daughter would vomit or get food she didn't want and stuff it down the sofa when I wasn't looking, kind of do it in her hands and put it down the sofa. So I ended up with a sofa full of mold and had to buy a new sofa. It's another expense. And these are things that, you know, people just aren't picking up on. We went for private therapy once. Everyone said, go and see this man. He's, you know, the new Messiah. He will cure your child. Once I'd paid £200 for that 1 hour, that wasn't happening again. He could have been great. That's just beyond what we could afford. Shall we move on to the next slide? Because I think that brings some of this in. So these are other costs. These are costs that I don't think we had, but they're things that people have told us. If you need wheelchairs, you need rails, you need mobility aids, there's a cost to that. Is this your slide?
Yeah. Yes. I mean, we've got a few things on here. So we've got mobility aids, insurance, holiday, car, multiple unnamed drivers. Yeah, basically, if you're insured for a car, you might not just have to have insurance for yourself. You might have to have insurance for other people who are going to drive your car. So multiple unnamed drivers. Hotel rooms, is that for if you're visiting specifically?
Yeah, if you
Yeah.
want to go away on holiday, because why not? But also if you have to stay somewhere because, you know, you live in Newcastle and your appointments are Great Ormond Street and you have to hire an adapted hotel room.
Yeah, I mean, even in your house, I think, was it Sue or maybe mentioned how there's adaptive furniture for housing, because like I said, sometimes the NHS might put in a one and rail, but there's still other things that you might need to buy, like a bath rail or electric blankets, all these things as well. Especially electric stuff, it's costly for the electric. It's actually costly for the energy as well. It adds to your bill. So I think Catherine was mentioning that she knew somebody who had to have their washing machine on all the time because it was a sensory thing. The person liked to see it. But can you imagine the cost of that all day for your washing machine on? So all these things, gardening, but somebody might have to come around and do your gardening, not the handyman. All these little things that we might take for granted, all these things cost, and it's not luxury costs, these are necessities.
Yeah, and I think these are all things that parents have spoken to me about. We had a parent, you know, in much the same situation as Esther, you know, couldn't get a school for her child, needed to go to a tribunal, but just had no way of finding that extra £21,000. So as well as caring for her child at home, she was running around organising beetle drives, quiz nights, jumble sales, selling her furniture, anything to try and raise that money, that just to get her child into school, not for anything that any other parent wouldn't have. Having to pay to prove that you don't pay. So if you want a cinema card, there's an admin cost. If you want a blue badge, there's an admin cost. All these things add on. And, you know, saying because of this, people with disabled people with disability in a family will begin to take out unsecured loans. Someone will knock on their door when they're feeling vulnerable and say, you know, I can give you this money to get you through the month. You know, who uses doorstep loans? they get through the month, they get to the end of the month, they get to next month, you've got to pay it back. You're in an even worse financial position. And this is all these things, this added cost, and you know, beginning to get into debt just spirals and spirals and spirals until people can't see a way out. Can we go on to the next one? Yeah, and this is what I kept hearing. It's fine if you can't work, you can claim benefits. The benefits, you know, I didn't have time, energy to claim them. They weren't going to cover what I needed. It really felt like a dead end. I'll carry on working then. I can't work because I can't get there. I can't physically work. I'm doing so many other things. I will get sacked. Okay, I'll try and find some middle ground and I'll apply for a charity grant. I know there's some funders on here, but this for us just really felt like a dead end. I applied for transport costs to be told I lived in the wrong place. If I lived the other side of the M25, I could get help with those cabs and tube fares. But because I live this literally walkable distance from it, I can't have anything. I can't stay in parent accommodation because I live on the wrong side of the M25. I can't have short breaks because my child has the wrong type of disability. My child's IQ is too high to fit into any of the charitable funders. So, you know, these three things just had me on a carousel of trying to go from one to the other, expending more and more energy and just really feeling like we were getting nowhere. And I'm sure there's a lot of other people in that triangular corner as well, not just me.
It's a catch-22 situation where no matter what you do, is barriers there. And it's the same for a lot of families that we support. They're in the same condition, and especially if it's like there's a lot of conditions now that we know about, but a few years ago autism wasn't known about, so there was probably less. It was harder then. So there's still now the cost of unresearched conditions where people have to get treatments and stuff, and it might not be available at the NHS because it's not a condition that's they consider fundable. And the paperwork that it takes to get these benefits, as Kathy explained, it's hard work. It's actually probably harder than getting a mortgage, and not everyone's skilled enough to do this. I'm not personally skilled enough to do all this researching for the best benefits and how to apply. And sometimes if you speak to somebody on the phone, that's another thing. You could wait half an hour, 45 minutes just in the waiting list, listening to jazz music and being told you're 31st in the queue. So it's very difficult. And so it's the barriers that we put up for people with disabilities that actually gives them a disability, not their disability itself.
And we were talking earlier, there was one of our adult service users was trying to, they claimed PIP, they'd gone through it all, and the advisors had said, I don't really think you're eligible. We need to have a conversation about this. They were too anxious to do it. So we said, come into the office, we'll do it together. The phone call was 3 hours long of answering intrusive personal questions about why do you think you're disabled? And that service user was in bits by the end of it. She'd been asked about everything from her gynecological needs to her mental health needs. It was just appalling, and it just feels so unnecessary, which is something we'll come back to towards the end. Can we go to the next one? Yeah, so this is kind of the logical confusion. I can't work, I can't rely on benefits, I can't get a grant. What does that mean? This is just where you end up, in a state of poverty. I'm not saying destitution. I'm not saying I was living in a sleeping bag on the street, but poverty, which means the income level for employment is so low that you can't meet your basic human needs. Do I eat or does she eat? Do we pay the rent? You know, do we have clothes?
It could even be that I've got a job, but I can't afford to get to my job. A lot of people have to walk to work as opposed to catching the bus because they can't afford the bus fare.
Yeah, but can I walk to work? Because I haven't got time, because by the time I've walked to work, I'm meant to be in South London at a meeting. You know, but this is, you know, and this is the true state. 3 million non-disabled people living in poverty where someone is disabled. So nearly half of the 40 million people in poverty are affected by disability. That's a huge amount of people to be living in poverty. Okay, should we move on? To make things worse, you know, just because we weren't all depressed enough, we've got all the additional costs, we can't get any help. You know, we're living this hard life. And I love my child. I love her more than anything. She's, you know, the best thing in my life. But it's hard work and it's tiring. And they're saying disability is both a cause and a consequence of poverty. Poverty can limit access to healthcare and preventative services. You know, it affected my mental health. As I said, her dad had a stroke. I ended up on antidepressants. Everybody was in a much worse physical state towards the end. The Samaritans have done a report about the high levels of suicide in parents and carers of people with disabilities, and how, you know, that's just not on. Why are we pushing people into this situation where, you know, they just feel there's no way out of this poverty trap and it's not worth living anymore? People with more ill health, and parents that I've met that aren't, you know, they're not diagnosed with diabetes, they haven't had their leg amputated, but they're just worn out. And anecdotally, parents that are telling us, you know, I collapsed, you know, I've had to go somewhere, and even worse, you know, I dropped dead. Well, they didn't tell us that. You know, parents that we've seen that suddenly have just died. And should we not be looking more into this about not just the person's disability, but how it's affecting their family and what's going on for them, and how we can better support people? Something else someone said to me is they went into hospital for a kidney transplant. They knew they were going, they got insurance in the first place, they were paid, they got a payout for each day they were in hospital. It's this idea, if we could get people into systems like that, if you could have the money to invest up front, which you don't have when you're caring for someone disabled, it would really help families to keep afloat. Yeah. So this is kind of the conclusion, being in persistent poverty, that it's not something that, you know, the hidden cost is that it doesn't go away. Our children don't get to 18 and then go, you know, I'm going to give you some rent, mum, I'm going to contribute to the house, I'm going to go and get a job, I'm going to leave home so you don't have to pay my bills. This is going to carry on, and people, you know, once they're in poverty, are more likely to get caught in this cycle of persistent poverty, and especially if they have children with disabilities.
I mean, the emotional impacts, I mean, we've mentioned it, but we have to really think about it. I mean, any parents always wants what's best for their child, and no parent ever feels like they're good enough anyway, no matter how brilliant you are. So just imagine the feeling of this on you. You tried your best, but the system just feels like it's against you, it's against you, it's against you. This is going to have a detrimental effect on a lot of parents. So a lot of parents are their sole carer for the person. They haven't got a carer that they'll go and give respite. They are the prime carer, as well as the parents. And it's a lot of strain that we don't see on parents, because a lot of parents that I see, they come in and they do put a smile on, but when you speak to them, you know that there's more going on that they're not talking about. So we really need to have more platforms as well, where parents can actually talk about and share this. So thank you to the parents like Sue and Kathy. And
and I think that's something, you know, I wanted to say, you know, it's not just about poor me and people who are in poverty, it's about destigmatizing it. I'm not saying this is anybody's fault, this is anything that the parent did, that the family did. It's just, you know, statistically this is happening. What can we do about it? What do we want to take away from today? You know, how can we look at ways of assessing people, as telling your story once? As, you know, you're a registered person with disability, why do you have to keep proving that you are? Not assuming that going into hospital or going into residential care means there's no more spend and there's no more demands on the family. Something I forgot to mention, which is probably quite big, when my child transferred to Simmons House, we'd got her PIP in place. So I was like, great, you know, she's in Simmons now, we still have to do this evening and weekend stuff, but she can fund it herself from her PIP. got about 9 months to a year into the placement, got a call from the Department of Work and Pensions. You know, you're not allowed to claim PIP when you're in hospital, even though she's got claiming, you know, she's got to find her own food, her own travel, her own way around. You now owe us thousands of pounds. So we've just about found a way out. We've claimed that benefit, but because she was readmitted to what is technically a hospital, we now have a big debt of thousands to pay off. Acknowledging these costs in benefits and grants, employers, you know, being able to do flexible working. I mean, I have loved COVID. You know, it's a horrible thing, but it's meant all that pressure of having to go to meetings, having to be in the office, having to do things, and being able to look after your child at home is a million times easier. Can we keep, please, some of these flexible arrangements? Affordable, accessible, and appropriate childcare. You know, I know we need specialist carers. I know they need paying, but we've got to make it so it works as well for the council and the charity that needs to stay afloat. It has to work for the parents as well. And really, you know, at the end of the day, appreciate these families, appreciate the tenacity of our parents that are caring for disabled and sick children, appreciate the skills and the things they contribute to our community, and make sure that we're not penalising them just for being the parent of a disabled or a sick child.
Yeah, exactly. I mean, I can't say anything better than this.
Okay, so we can take the slides away. We finished slightly early, but over to you.
Okay, I think, thank you, Kathy. Thank you, Kenny. I think Meredith would like to come in with her part of the story.
Absolutely, that would be great.
Oh, I just shared in the chat, but just to echo that my experience was very similar in many ways to Esther's, in that, you know, it was very clear that my son needed a lot of additional support, but the school agreed, and all of the therapists that we'd visited agreed, but the local authority did everything they could to try to block that, starting with denying him an assessment at the first stage. And the person who was looking over the paperwork and was supposed to send us the letter that that gave us that denial called me to say, I'm about to send this, but this is wrong. This is what you need to do to appeal this. And we had to appeal at every stage. I understand from the National Autistic Society that parents who appeal get what they asked for in something like 90% of the cases. So it's just because the local authorities are stretched, I guess, that they're denying everything and then waiting to see who's got the time and tenacity to come back and argue with them. But it shouldn't be that hard. It was a year and a lot of expense, and I mean, just reams of paperwork to try to get something that everyone agreed my son needed. And we were lucky that we were able to take the time to make that happen. I was able to take time off work to go to all the appointments and fill in all of the paperwork, et cetera. And we were able to make it happen. But if you're not confident enough to challenge the local authority, if you're not, can't find the resources and time to do that, then you're left without the support you need.
Yeah, and I think that's so true from what I hear from so many parents. And I think sometimes it's not even having the capability or the will. You're just so tired. You've been through so many different places. You know, your child is weighing on your head, as Sue said, you know, destroying your house. And then you've got to pick another battle. You know, I really feel for you there, Meredith. You know, it's not easy.
I think to reiterate Kenny's point earlier, sometimes it's the battles that are more exhausting than the actual condition. And I think that's something certainly I've heard over the years so many times. It might be interesting to have a look at the slide that, the last slide where Kathy listed a number of things that perhaps could make things different, and to talk a little bit about what people feel about those things and whether there's anything that we've missed on there as well. Is that possible, Keir? To put that slide back up. Sorry, I just dropped you in it. I just assume that technical people can do everything. No, the one before that, that's it, that one. So the things that were being suggested were assessing people as people, which sounds obvious, but perhaps doesn't have, yes, I know. Do you want to talk a bit about the hospital stay bit? I think try and get some kind of real points out and things that we think would be solutions.
Yeah, I mean, I think it's this blanket assumption that if you're in a hospital, that they will take care of all of your needs. They will feed you, clothe you, you know, you will not spend anything, which is essentially what the PIP and DLA people are saying. If you have to stay for more than 28 days, you don't need a living allowance because it is being provided by the state. And as I hope I illustrated in that story, that's just not true. All you end up doing as a parent is running 2 households. So, you know, I have to buy food for here, I have to buy food for there, I have to buy shower gel for here, I have to buy it for there as well. You know, I have to go back and forwards on the tube with massive bags of washing that I have to bring home, wash, tumble dry, take back. You know, and if you're that person who's on PIP and have to stay in, say, for 6 months, I don't understand how you're meant to provide that if your benefits have stopped for yourself.
So that's a question that we could raise with the Department of Work and Pensions.
Yeah.
I mean, what I'm doing is I'm taking some notes as you make, as you know, as the conversation goes forward, and then we can see where the responsibility lies for these things. Can I ask you a question, Kathy?
Yeah.
Or anybody that's actually on. I mean, would you have preferred to have had the money available to buy these things and to do it, or would you have preferred when she was in hospital for them to have provided what she needed and for you to have provided, say, with a travel card or something like that? Which would be better?
I think that would have been better, because it would have been about, you know, the specific thing that I was struggling to pay for, but also taking some of the load off.
Yeah, okay.
Because, you know, when you're looking for food in, do I do an additional trip to Aldi or Lidl without my car, pick it up, take it in because that's cheaper, or do I try and shop for food in Russell Square or Belsize Park? So I end up having to shop in M&S or like the poshest budgings in the world, which costs a fortune, but saves me time. You know, so it would have been much better if they said, okay, you can't eat these things, but could we order you some Kellogg's cornflakes? You know, I'm not talking about caviar. You know, it was porridge, it was protein bars, you know, it was things that weren't on the standard roast dinner and jelly hospital ward menu.
Sounds lovely. Okay.
And I
Anybody
think
else?
as well, seeing this disparity, you know, there were people when we were in Great Ormond Street, you know, that said, oh, our child is here. There was one mum I remember, she said, it's going to be really difficult travelling backwards and forwards, so we'll buy a flat in Russell Square and we'll have that as our town flat. So, you know, we can stay there and visit and then we can go back home. There was other mums I was talking to who were saying, I'm having to choose. I can only see my child once a week. Because, you know, I work in a supermarket and I can't get the time off. I can't afford to get here on the tube. So they were actually being forced, you know, so both ends of the scale being forced to make that decision. My child's sick, my child has mental health issues. They have attachment issues. They're worried about abandonment where I am, but I can't come and see them because I can't afford it. That just doesn't seem fair.
No, indeed. I mean, I think that links with the next one, which is about acknowledging the costs in benefits and grants. And maybe at the end, we can try and get a sentence together that encapsulates all of those things. What about the next one, flexible working? What about some of the other parents? I mean, I don't know if any of you are in work or have been in work. Would anybody like to share anything around working?
So I don't work, as I said, I'm disabled, but the benefit system is quite similar for the adult benefits and the children. So when I applied for PIP, they wrote a whole report saying Esther has no problems going to the toilet. We can see her catheter under her skirt. I had 2 stoma bags, and then they're like, oh, we're not going to pay for that. And so it was a bit ridiculous. In the end, they did, but I had to fight for that. So, yeah.
Yeah.
Yeah, it's the same for, unfortunately, it's the same for adults with disabilities. Then with children, they expect you to just get on with it.
Sure.
And fight.
So we've
This
got,
is the thing, though. It's the having to fight for everything. That's the worst part of it.
And I think, you know, I'm not sure where we can take flexible working. I think what I'm thinking in my head is just that people are aware and can have a bit more empathy and can say, actually, you know, we're Tesco's, we're a multi-million-dollar, you know, appreciate that. We're a big supermarket. We can probably afford to give this person, you know, 1 shift off a week. Can we be human about this? You know, how can we humanize what, rather than, you know, it's a big payroll and you just, if you don't come, you get sacked and then you're pushed into that trap. Because flexible working can be a double-edged sword. When, you know, bosses say to you, well, you can work from home, but you have to work on a, you know, do your hours as much as whenever you want, so to speak, because you're stopping for meal things. So at 2 or 3 in the morning, you're catching up on your work because you've been offered flexible working, but the only time you can possibly get this rota together when someone isn't screaming in your face and things aren't going on is the middle of the night. So do you sleep or do you work?
I think that's a very important point. I mean, the TimeWise campaign have been trying to push companies for flexible working, but I don't think in the way you're describing. And it might be worth talking to them about how they describe flexible working, because I agree with you. It's you know, is it working more to manage the flexibility?
Yeah.
That's
Or
not-
is it a boss who says, look, if you're having a really shabby week, just tell me and I'll get you someone to help you with the rate of that week. But when things are calmer next week, could you do this thing back for me? You know, it's not about not wanting to work. It's just having those, being able to have those conversations.
Is there something on the other side of that? And again, this is open to everybody to think about that meetings. Kathy, you described going to meetings about your child. And my understanding is that these meetings always happen in the middle of the working day.
Yeah.
So is there something about agencies, social care, health, whoever, actually thinking more about having meetings outside of normal working hours?
Yeah. And I think especially with the family training, you know, I understand if you've got to do a review for everyone in your department. And these departments work 9 to 5. Could they be flexible in that? Could something like CAMS work 10 till 7? I don't know. There's an idea.
Yeah.
But also think, you know, where you have to commit to this training every week. But I think the one we went to, it was something like 11 till 1. So it was the whole day out. Could it have been 4 till 6? So, you know, thinking of those things. And it's also about, you know, if you don't go, you know, you lose that. You don't know what's going on for your child, but a lot of the time it's a meeting about a meeting and you get there and it's like, oh, same stuff.
So can I ask you a question? Some of these meetings, has any of these meetings moved onto Zooms?
Not for me, but the therapy at the moment is on Zoom.
Okay,
But because she's an adult now, I don't go, so possibly other parents would know that.
that could be a way of not having to keep going there. It's more flexible if you can, if some of these things are allowed to do it, like we do this on Zoom. I'm not sure if you have to go there personally all the time.
Yeah, no, it's a good point. Has any other parent been offered Zoom virtual meetings?
Nobody's coming up in the chat.
No.
I mean, again, that's something that, oh,
Yes,
Jen,
Yeah.
Jen, do you want to just tell us what your experience was of that?
easier.
Right, makes it much easier. So the experience of meetings, appointments aren't clustered, Meredith is saying appointments aren't clustered. Or, oh, right, okay. It breaks up, that's right, it breaks up the whole day. Zero choice of time and very little notice, even with a flexible employer. That makes it very difficult.
And I'm sure my employer would vouch for, you know, my rage at the times when I went to meetings and got there and they'd been rescheduled or cancelled and nobody had said, is another thing.
So communication as well about meetings. And Jen is saying not about having to spend hours traveling to different appointments. Never ending.
Yeah.
I think that never ending bit is something that a lot of parents would agree with, that it feels like it's never ending. I think one of the things that's coming out is something about disrespect to parents of a disabled child, not respecting the fact that their time matters. Does that feel right?
I always felt, I don't know how other people, that I was the least important person in the room. That people would arrange an appointment at times that suited them and then tell me what they wanted to tell me, and I was just a tag along, when in fact it was my child. And I think the other thing that used to infuriate me, I agree, Jen, but the thing that used to infuriate me was at one of the hospitals, I won't name them, you had to get there on time. So say the meeting was 9 till 10, you had to be there at 5 to 9. Then they'd go, no parents allowed, we're going to talk as professionals first. So then you had to sit there like a lemon in the waiting room for half an hour while they talked about your child and then invited you in. And I'm like, if you want to do that, tell me to get here for 9:30.
Again, it feels like it's about disrespect.
Yeah.
Along with everything else. I mean, when we talk about poverty, poverty is very wide ranging, and it certainly means poverty of money, which you've talked about very eloquently, but it's also poverty of time. But maybe there's something else here as well about poverty of respect, actually acknowledging the fact that you are assessing people as people, that you're a human being who has a wider life, not just being the parent of a disabled child.
Yeah. And that's what I was saying in the earlier bit, you know, somewhere on the line, you disappear. You become someone's parent, someone's campaigner, someone's finance manager, someone's entertainment manager. But things that you want to do, you know, are so far down the list, or things that you want to eat or wear or buy, they're just not there anymore.
Well, Jen has said you never feel heard and feel passed on to the next person. And I think that really reflects what you're saying.
Yeah. And, you know, I'm talking as someone who has worked within this sector and has some knowledge of how to navigate the system. You know, I dread to think if I were in a different position or spoke a different language, you know, or everything was new to me, how I would feel then.
Yeah, Keir's just said, and Keir, do feel free to speak, even though you're doing the techie stuff, that he feels the dignity and sanity of parents is constantly under attack via these meetings. It's been getting worse over time. Has there ever been a time in the past where it's been different?
I don't know.
I don't think so. As somebody who navigated it a very long time ago, I think, I mean, my story of occupying the Director of Education's office to get a report done is infamous in Barnet. But I don't think it's ever been better. I think perhaps there was less, I think people didn't talk to each other in the way we are today, and perhaps that's what's changed. We're understanding more what the problems are, which is all very fine, but what are we going to do to make that better? What can we do? Oh, I'm in a
Can I say something?
Yes, whoever that was.
Just I think we can collaborate. We should work together better. I think the skills that we have as parents, we can share with somebody else who is working with us or managing our kids. It's up to us to put them straight and let them know. I mean, I'm nobody. I have 3 children. My eldest has got a rare genetic condition. From the minute he was born, I had to navigate the system. I was a child from care, so I grew up in care. At the age of 15, I was out there on the streets. I had to work out how to get an education, how to get a job, what to do. I'm the wrong colour. I'm a woman. I'm strong. I'm, so many things. Today, I run an organisation by reaching out to other women like me. I just needed a mum like me. Found someone in New Zealand, found another one in America, and before you know it, we're 35 countries strong. But I'm not anything, I'm just another woman. But it's about women, it's about education, it's trying to give our children and those that we work with the tools. So if we don't like them or we don't like what we do, give them the tools. It costs us nothing. But if we teach them from your skills, Catherine, I've listened to you for ages for this whole tour, and you're very, very strong, and your experiences you can graciously impart onto somebody else to empower them so that they do a good job for another child. Because if we don't pass on that book and we don't pass on that language, we're going to always be in this space that we're in, and I think we as women have a duty to run with it, pass the baton. But I only speak as me, but yeah, I've loved this. I just found it randomly, but I've really enjoyed listening to you. You've got a lot to give to others. You're a very skilled woman, and you can give it to someone else, because if you give it to them, then they'll give it to someone else, and it makes a difference to everybody then, because it takes I know that saying's probably quite large, it takes a village.
Yeah.
Raising a family. I raised my 3 as a single parent. I had no choice. I needed to keep the roof over my head and food on the table. And trust me, I was taking I roll with the punches, but I was taking none of it. And at the same time, when then you sit at a corporate table or you try to work with authorities or clinicians, whatever it is, they're the first people to question you. But actually, they're learning from you because they've not had your experience. So you can give a lot. So just give unconditionally, and it's the best way for it to affect another child, another family. Yeah, I'm not saying anymore.
That's amazing.
Could I just say something? Just following on from what Michelle was saying, I wasn't going to mention anything about what I do for my job, but I facilitate a charity which is a parent forum, and all boroughs in the country have parent forums. And I don't know if you know that, but the thing is we work with as we're all parent carers, all our trustees are parent carers, and we work with the local authority, social care, health, as in engagement and participation. So we are the sort of voice of the parents. So we ask parents to feed back to us. They can join in if they want. They can attend meetings with us, or we attend on their behalf. And it's and we do. There are some really good people in our local authority who want to help, but when you speak to some of them, you're just numbers. It feels like you're just numbers. Oh yeah, we've got so many. I mean, we've got something like 7,000 in our borough, children and young people with disabilities. They're the children that they know of, and that are on SEND support and education, health and care plans. And it's just, they're just swamped. They've got no money, and they're trying to do a job with no money. So it's literally, well, what can we do? How can we do this with the minimum amount of money? And so it's just a crazy situation. And some of the, and then it just, and most of it, they never see a child, they never meet a child. The caseworkers never see the children, the 250 children that they're supposed to be looking after. So it's really difficult for them to sort of have any empathy, which is what you find they don't have. And then it makes you feel like you're constantly fighting the system, which you are. We all, you know, everyone is fighting the system, and for our children that are the most vulnerable in society, or one of the most vulnerable sets in society, we shouldn't have to do this. It just makes having a disabled child harder. It's not our choice. It's not something that we wanted to have. It's just the way that it is, and they should be there to really support us. And unfortunately, it always comes down to money.
Yeah.
I wonder, just a quick question, and I know there has been some research, and I'm going to ask Keir, who's very good at research, to find it for me at some point. The cost to local authorities and to health of defending themselves in tribunals where they lose. Perhaps if that money was transferred over to supporting families at the beginning, it might be more cost effective. We've
tried to find this out. And, you know, I've tried through the parent forum, I've tried to find out, okay, so you make the families go to appeal, because even whether it's a needs assessment or to actually issue a plan, so or even making certain changes, so you just make it so difficult. But the time that they, by holding it for about 2 or 3 years, the money they save on not issuing a plan saves them a fortune. Yeah. So, but the thing is what I was trying to find out is where does that money come from? Which pot does it come from? Does it come from the SEM pot, or does it come from another pot that, you know, a local authority pot for appeals, random appeals? Because if it comes from their own, they should be using that money to support the young people. But usually they settle, as you mentioned, I think someone mentioned earlier, they settle just before. They make you go through the whole thing, then they settle, you know, the day before, and they'll say, no, we'll give you what you want.
I'm sure there is that
clinical commissioning,
and I will try and find it. Meredith's got her hand up. Do you want to speak, Meredith?
Yeah, I was just going to say, and by the way, I'm sorry that I don't have my camera on. I've just got terrible Wi-Fi at the moment. But when we were going to tribunal, and ours went all the way, they didn't even do the day before settlement option. The law firm that our local authority had hired to defend them, a few weeks later got into big trouble for posting things on social media, making fun of the parents who they had gone up against, and were, I couldn't believe it. They posted messages that on Twitter, so everyone could see it, saying, oh, today we had a parent in who was trying to argue, and just having to laugh at it. The borough promptly fired them, but that was, you know, the same firm, and it could have been the people who I'd been in a tribunal against a couple of days earlier, and it was just shocking. I think, you know, with autism specifically, because that's what my son has, and so that's what I know. You know, I think the diagnosis rate is now something like 1 in 33 children has a diagnosis. That's basically 1 per classroom, if you think of classes being 1 in 30. If you think about how much money gets spent on gatekeeping and how much money is spent on rationing, if you just put all of that into having an extra teaching assistant for every classroom, you put it into having speech and language and OT available in each school rather than rationing, wouldn't that be better for everyone? Just assume that each school is going to need a certain amount of this provision rather than hoarding it and making it so difficult. It was so frustrating.
Thank you.
So just on the back of that, they do have nominal funding for children with SCN. I don't know if you have your £4,000 for your mainstream place, and then the schools are given £6,000 per young person for SEN support. That's without a plan. That's before you get to a plan. So they just have to call it in and they can have that money. But the thing is, it's not ring fenced. So that money is not spent on those children. So that's the problem. This money should be ring fenced for those children. Whichever, and with £6,000 over a year, you can use that on more than one child if you did a little group things, but they're just not using it because the schools are also underfunded. You know, it just goes round in a big loop.
Yeah, and in our case, our son needed a full-time one-on-one support. And so the school couldn't fund that out of their budget. They needed the local authority to top that up, but it was just difficult to unlock it.
Yeah, and it is hard. I mean, you know, there was theory that my child, when she went to a pro in the end, and should have had one-to-one support, but they weren't going to fund that. So I spent a lot of time in the street waiting for her to come flying back out the gate, because I knew that at some point in the morning she would have absconded. So I'd take my work and sit on a bench and then catch her, because, you know, that funding wasn't there. It just doesn't make sense. You know, this is a specialist provision and it's still, you know, not working.
Michelle, you want to say something?
Thank you. Within the local authority, the local offer really shows you how, when you've got an EHCP for a child, the local office is an opportunity, definitely a review. When you're reviewing the EHCP, it's a time for you to try and look at the clinical commissioning group and what funding they're providing, because they're two different things. So when it comes to like the one half of the plan, if you like, always look at the local authorities' local offer, but also look at what the commissioning groups are putting forward, because an education, health and care plan, which is what's in England, is not just one part. You can mix them together and get more money so that your child gets a better offer. So as an example, my son, when I was struggling to get an EHCP, what I did was, when I finally was able to get one, he's now 23 years old, my eldest, so he's older. But when I had to go through this process blind, when you get your EHCP and it's been awarded, they have to review within a certain time frame. And what then you have to do is, when you get the review, you want to bring in every single clinician or anybody that's there for your child, and to help. Now, at that point, you look at the local authority's offer and see what the local offer is, because what that means is you can get more stuff into the plan. Remember, if you get this plan at 6, you can then carry that through to 25. It lives with your child like a growth, you know, and it's massively important to try and look at the different types of funding that are available, because the local authority aren't going to tell you about a clinical commissioning group, but, you know, potentially it is there, and it's there for you to be savvy about how you approach it for your child. So you can, and you know, you can always reach out to your group, people that you've met on your journey, and ask the questions, because someone's going to give you those answers. If you don't know them, ask somebody who might know. And you know, I really appreciate.
That's definitely.
that.
I used to call my daughter the hot potato, because she didn't have the right kind of disability. She didn't have the right kind of mental health. Sorry, no one was taking responsibility. And that's why when I was talking about tripartite panel, we couldn't take, she has an EHCP, but children with disabilities wouldn't take it. She wasn't a child in care. There was safeguarding. She was only a risk to herself. So nobody would take it. Everyone just went, oh, phone this other team, go somewhere else with your EHCP. And I ended up having to go to the CCG and being, you know, really quite pushy to get to where we needed to be. You know, like you're saying, no one was saying, oh, I've seen that before. If you fall through that gap, go here. You had to go and force yourself onto people and say, I'm knocking on your door. And, you know, luckily we have it now on her EHCP. She's got a really good one now. She's got a bespoke EHCP attached to a psych unit. So
I like that.
she does makeup, she does Makaton, she's got loads of good training stuff. So we're now in a really good position for her being at, because what she can do, but it's really hard.
It's harder down south. I think it's harder down south than it is up north. But you're going to get it in the UK. I mean, across the board, we have such differences between it. I mean, I shouldn't say use. I joined the Council for Disabled Children because they've got some really good advice. The advice that they give doesn't mean that they're going to come in and help any of our kids in the UK. And our genetic condition is 0.4 per million in the general population, its prevalence. So it means that there's only a small amount of kids, and they're the one, you don't see them. Our kids look like they've got Downs, but it's not Downs. We're in a position where before everyone knew what Downs is, before everybody knew what Downs is, then now you know what it is. But we're sort of like at the early stages of our awareness. I see some of these families and know as a mum, I cry. It makes me really sad that we can't get help for a lot of our children. But you have to know about the funding. If I can give anyone that advice, it's get involved with the funding, find out about different types of funding, because it's got a different wording. It just means that it's not accessible to you, but actually it is. Find someone who knows, and keep in touch with them and find out. You can. It's hard, and it's very stressful, but you can actually find answers for your children, more than one child at a time.
Yeah, and that's what, then like you're saying, trying to share that, I'm trying to say to other parents, oh, I went down this route, you can do this, if your child has this, try this organisation. But I think, bringing it back to kind of the top of the conversation about the poverty that the families are forced into, it's even harder when you haven't had anything to eat, when you're stressed about the man coming back to knock on your door to pay that loan back. And it's, is there something we can do to find that security and stability for families so that they can fight the fight, so they can care for their child?
Yeah, I think we can do.
That Jen has put up the difficulty of getting an EHCP in the first place, and that no one seems to want to help. You have to navigate blindly, and she's battling to get 3 EHCPs. And I think that does vary borough to borough in terms of what's happening. And I'm a bit out of touch with where things are at the moment, but certainly it used to vary enormously from borough to borough about how easy or difficult it was to get an EHCP. I think perhaps for Jen Sue's point about parent carer organisations borough to borough is a very good one, because they are there and they will try and help. And if you've got a good carers organisation in your borough, they should help with your EHCP struggles. We've got a short time left, about 5 minutes left. Is there anything, before we come back to Kathy and Kenny to finish off, is there anything that anybody who's on wants to raise or to say at this point? Yeah, I mean, Kate is saying she just wishes everything was